Well, good morning, everyone. It's Medical Monday. That's when we check in with CHI St. Joseph's Health. And today we get to visit with Lisa Lifgren, and she's with CHI St. Joseph's Health Hospice Care. How you doing?
Good. How are you?
Good. No stranger to, we just did this winter.
Yes, we did.
Yeah. It's been a little hot, so maybe winter wouldn't have been so bad. But, we'll take these nice days for sure. So let's visit about CHI St. Joseph's Hospice Care, the critical element in our community, and I believe one of the best services available for end of life and helping families navigate that most difficult time. Tell us a little bit about CHI St. Joseph's Hospice Care. You've been doing it now and you've been busy with it for a while.
Oh, yes. Things are jumping. It's summertime, so we get travelers in too, or people that want to come back to the area, and that's where they're choosing to pass, is where they grew up or where they spent lake time. So it is busy, definitely more busy than it was this winter. But hospice truly is, I think the question that most people have is, why would I choose hospice, or what's it going to do for me versus going to my primary doctor? And I think the main thing to remember is that we are not curative, we're comfort focused. Mm-hmm. So you can't control that illness that you just got or that you've had for a few months or years, but you can control your care. And that's what we're here for. We want to help you control that care and make sure you're comfortable in your final journey.
Sometimes there's some misconceptions about what hospice care is. We'll break it down a little bit and help people navigate it a little bit. Our family is familiar with it, like we've shared, and I find it truly amazing. Generally, end of life, sometimes someone enters hospice care, comes out of it, which is great, is a great victory.
That's awesome.
But when you go through that process, just having people that deal with it often and helping the family do it and figure out these are the steps, here's some things you're going to start to see. It's so important.
It is, and most people don't navigate that or have never navigated that before, so they're really truly lost when it comes to reaching out to us, and that's what we're here for. We're going to educate you. We're going to walk step by step, holding your hand through the journey, making sure that you're understanding the steps that we're taking and that everybody is playing a part in helping that loved one live their final journey. Mm-hmm. So we have the nurses, we have the chaplains, we have the social workers, we have the HHAs, and they all play a part in making sure that that care is taken care of and well-rounded.
Many people think that hospice is only about the very last days. Been part of family in and out, depending upon the care, and they had graduated back out. But it can be a short period of time or it can be lengthy, depending upon what's going on.
Yes, every person is completely different. There's certain diagnoses that we have to follow for Medicare rules. Mm-hmm. But really, if we get those two medical doctors or two providers that agree that if whatever the diagnosis is going to run its natural course and you will eventually pass within that 6 months if it was to run eventual cath. But that doesn't mean that you're actually going to pass within 6 months. Mm-hmm. Some people do, but some people, like you said, last years. And some people even get better and graduate, which is a celebration in itself.
Usually they have to have a diagnosis that says they're end of life.
Yes, for sure.
And then of course, like you were saying, the hospice care can administer meds and things for the patient, but it has to be prescribed by a doctor.
Yes. So we work very close with our medical provider, or our medical director, I should say, and then their primary doctor. Mm-hmm. And so those two doctors will prescribe the medications needed to keep that patient comfortable. We're all a team. We're all playing a part. We're all making sure we're covering each other. We meet every 2 weeks and go through every single patient, make sure their plan of care is on point for that patient. And every plan of care is so different because it's individualized per patient.
Yeah, beyond the medical care side of it, other kinds of services and support that actually come through the hospice care plan. You can be at home.
Yes, absolutely.
You could be in a nursing home.
Absolutely.
You could be in an assisted living space. You could be at a daughter's home or
absolutely.
You can be any environment.
It's wherever you call home. So whatever place you call home. Not particular St. Joe's, because I haven't been here with St. Joe long enough, but the other hospice that I worked with, we had people in jails. We had people living under the bridge. It's where you call home. We're going to bring the service to you. Other resources. We use community resources as much as we can. Like I said, we use that social work, that chaplain, and they all bring in a piece of the puzzle to put it all together to take care of that patient. Yeah. Your social worker is your paperwork people, and your chaplain is your minister. And sometimes it's not even about God or the Bible. It's about just having somebody to talk to and without a judgment ear. And
every person has walked a different path in life, and potentially hospice identifies with the families some of the the walks of life, and then try and just bring it all back home for them, make them comfortable, tie the family together, make sure that the family is aware of what's going on. Just the educational process of end of life through hospice care is, I think, the most important part of what you do.
I think you're probably right, and I think a lot of family members, like I said, haven't walked this journey before with their loved ones. It's new. We've seen it time and time again. The body typically follows a certain plan or process as it's passing. It's much like having a baby. You're going to plan for it for 9 months. Death, you don't maybe not get that much time to plan for, but we can educate on where you're at, and we're going to meet you where you're at, and we're going to walk from there on and try to educate you every step of the way to make sure that you understand what's happening and what the next step should be.
Not only the patient, but the family.
Absolutely. The family's the one that usually has the hard time wrapping their head around it. The patient's already kind of known or already has wrapped their head around what's happening, and so the family is the one that's really struggling.
And they're feeling it too.
Yeah, absolutely.
The patient is feeling it,
yes.
So they're feeling. So some of the big concerns usually with hospice care, and it's my experience has been is symptom management, the pain management side of it. There's so many things that they could be going through with their illness that requires a different treatment, requires different pain management. That's again where the hospice team working with the physicians and also through your directive, what's the next step?
Absolutely. Pain is the number one thing that we want to make sure we're controlling, because there's always going to be pain with death. It's maybe not physical, it might be emotional, but we're going to deal with that as it comes. And then the number one med that we use for that is morphine, of course, and everybody's a little nervous of that, but we don't start you on high doses. We actually microdose you and slowly increase it as the patient needs it. And then, of course, we worry about the agitation and restlessness for end of life, because sometimes people become restless because there might be something they need to say or somebody they need to say goodbye to. So we really work with the family on, have they said goodbye to everybody? Is there somebody that we need to try and get a hold of to bring in? If not, they just might be having end of life restlessness or anxiety. We will address that and get, again, micro dosing to make sure that we don't want to sedate them. We want them to be awake too as much as they can with the loved one, but we want them to be comfortable too. So it's finding that fine line between dosing and being comfortable versus sedating.
And everyone paces differently.
Absolutely. Yep.
You know those trends. There's things to look modeling and things that you all know.
Yep.
But when you go through the process and you try and make them comfortable, some will progress quicker than others, and that's a sign too. Say, hey, we need to get everybody here to come visit. And that's important because everybody wants to have that moment.
Absolutely. And when you get your loved one close to that moment, sometimes they just need to be comfortable to pass. And so then that's where the morphine gets the misconception that, oh, you gave them a dose of morphine, you killed them. Well, no, we gave them a dose of morphine and we got them comfortable enough to pass.
Yes.
So that's a misconception there. But again, we would talk that patient and family through it. And the other really important thing I want to stress, if somebody doesn't use hospice or is afraid to use hospice, that's okay. We're okay with that. We will educate you as much as we can to help you. Remember that they can hear right up till the end. And so it's always important to let that family or those loved ones in close. And we always try to back away when it gets close, because you guys are the important ones to be next to them, not us.
Yeah, the family, absolutely. That focus for the families, the patient, focusing first for the pain management for the patient.
Yes.
And then, of course, the families, and then at the same time making sure you're taking care of the patient so the family's not seeing some things they're going to get upset by too. So there's so many things that you work through, and you talked about it, the microdosing, making sure the family's involved, talking about how you can do bereavement resources and support.
Yes.
There's many steps to this, not only taking care of the patient as they approach end of life, but there's also resources that you provide.
Yes. So we, you nailed it. We do grief support. The grief support starts before the patient passes, because we need to be there for the family along with that education. But we do 13 months of bereavement support after the patient passes. Now, that doesn't mean you're going to hit 13 months and we're going to say, oh, you're done. No, it's going to be a gradual decline, and that bereavement specialist is going to help you with that. But we do groups, we do one-on-one meetings, we do phone, we do mailers. However, everybody likes it a little bit different as far as bereavement goes.
couple things that come to mind with me when having hospice care there for you. You know, you have a great resource that has done this multiple times for other families. The family can feel real comfortable about where it's headed, the process, not second guessing, oh, I should have done this or that or whatever. When you sit there and you have the opportunity to visit with the hospice care when this is occurring, just the things they tell you to watch for. This is what's going to be the next steps. This is what you can see. Hey, you might see this. Just understand it's okay.
Yes.
You know, I mean, that stuff, the bereavement side of it, that's so important too because it goes on. It
goes on.
It's a big void that they've lost, a family.
Especially if you were a main caregiver, that took up a lot of your time, because now all of a sudden when everybody goes back to work after the funeral or the celebration of life, you're by yourself. And what do you do with your time? All of a sudden you have all this time on your hand because you were the caregiver or you were the person taking care of or living with that person. And now all of a sudden you're by yourself. So that's a huge piece that people don't think about. So we definitely want to help educate you and prepare you for that too.
When it does occur, the bereavement management, helping, getting together, talking, the things you're feeling is very important. So getting into hospice care, tell me a little bit about the process. I think we talked a little bit about it earlier. When they get that diagnosis of end of life or, hey, there's nothing more we can do for you to cure.
Yes.
Then the next steps, what do you do? What's the next?
So honestly, anybody can call and make a referral or stop into the office and make a referral for their loved one. We get them from family members all the time. It speeds up the process if a doctor sends over the referral. That just helps us get into the medical side of things a little bit quicker. But really, we need 2 doctors to agree that you have a terminal illness. Mm-hmm. There's no aggressive treatment, then you're going to stop aggressive treatment. So no chemotherapy, no radiation, those kind of things. And you're just looking for comfort care. You don't want to go necessarily to the doctor anymore. You're sick of going to the ED. You just want to stay at home and just be comfortable and spend what time you have left with your loved ones, doing what you can. Mm-hmm. While you can.
Usually there is no further treatment to fix it.
Usually not.
Yeah.
Usually you've done your chemo, you've done your radiation, and the doctor says there's nothing else we can do. That's usually when the doctor sends a referral in, but we usually don't. We try not to call you the same day. We try to let you wrap your head around things and the family wrap their head around things, because that's the last thing you want, is to have that hospice call you and say, hey, I just heard you. That's awful. So we want you to have time to wrap your head around it. And then we'll make contact, or you can make contact with us if you're ready. But it's just meeting them where they're at, knowing that they may have just had a diagnosis or knowing that there's no more curative treatment available. So it's walking gently next to that patient.
So can it be the patient or the family?
Absolutely.
I mean, a lot of times
Yep.
I'm guessing the patient saying, hey, I've done everything I can. I need your help.
Absolutely.
Yeah.
The patient can call or stop in, or the family. Mm-hmm. It doesn't matter. It really, truly doesn't. Anybody can make that referral. You can call and make that referral. We can come out and do an informational visit, and we can talk all about this more uniquely for the patient. Mm-hmm. And if you decide, nope, that's not for me yet, that's okay. We will close it up, close that one, and when you are ready, we can open it back up and we can do it all over again.
Well, that's good. So, and then a lot of times we've talked about the diagnosis criteria and prognosis is that kind of typically would make someone qualify for the services.
Yeah, there's really no set one. Any cancer with mets somewhere, metastasized somewhere in the body, that's a pretty guaranteed one. Otherwise, dementia and Alzheimer's is a little bit harder to get on because it's a little bit slower moving, even though that's a awful disease. Otherwise, it can be kidney, it can be, it can just
stroke.
COPD, stroke, CHF, heart failure, hypertension. I mean, there's so many things that we can get you on for that most people don't even realize that they can get on hospice for.
Yeah. So a consultation, just a visit and find out what are these, what is the process? We've had this diagnosis. We're up against the wall here.
Yes.
What are some of the next steps? And your prognosis your doctor will lead you in the right direction, most of the time.
Absolutely. And the sooner the better, because that just helps us walk the distance with you so that we can really give you a well-rounded end of life. Try to check off those bucket list items if you have them, and just try to get that stuff taken care of while you're still here.
Yeah, so let's talk about, first and foremost, your staff. I mean, that's...
They're amazing.
They are amazing. I've met them personally on many occasions, and that hospice care, the staffing that's there, they become so much part of that family in that short period of time. Very hard on them, I'm sure, at the same time. But they're just trying to make that patient comfortable and get them through it without pain and having any of the concerns that most people just don't want to see at end of life.
Absolutely. They are so good at making sure that that patient is comfortable. They're all great at having that end of life conversation, the hard conversations that nobody wants to have. We've been through them a million times, so we're comfortable doing it, even though the patient and family might not be. It's the small rewards that we get of making sure that that patient was comfortable. You know, they may have come on to hospice writhing in pain or anxiety ridden, or just something's not right, and we can get them comfortable enough to pass, as well as getting family there to say goodbye. Those are the small rewards that are amazing.
And so many of the staff live here.
Absolutely.
We know them, families know them. They've walked many other parts of their life with them, and so they know.
They know, yep.
Yeah.
And some of the staff have had multiple family members. They may have had mom on a year or 2 years ago, and now dad's not doing well. So now they have the dad or the father, or they'll have the mom and the dad at the same time, or they had grandma and grandpa or uncle. And people remember that, and they'll specifically say, is so-and-so still working there? Can we have that nurse, or can we have that chaplain, or can we have that social worker? Yeah, of course.
Very much so. And so hard for them, I'm sure, too, because they become, like I said, they become integrated with the family through this process.
Yes.
And the most rewarding thing for them is, as strong as they are, and as hard as it is for them to see the same in the tears of the family, they're very comforting, and they're very good at what they do. So if anyone's listening and wants to know more, considering a hospice for a loved one, what's the best way to contact CHI St. Joseph's Health Hospice Care?
You know, they can call us at our telephone number, 218-732-4552, or they can fax us. The doctor usually is the one that faxes us, so that clinic or doctor can fax us, or they can even stop in. We're located at 323 South Main, right here in Park Rapids, right above Healthy Hangout. Come up and see us. I'm usually the one that gets to do the consultations, and I love that part.
Yeah, just visit with people and find out. Anything else in closing? Of course, Lisa, a fantastic Lisa Lifgren from CHI St. Joseph's Health Hospice Care. Anything else in closing that we might have missed? I think we covered a gamut of it in a hurry.
Yeah, we sure did. You covered very well. I just remember, if you're not going to use us or hospice, and we're okay with that. We want to help as many people as we can, but we understand it's not for everybody. Just know that you can still reach out and get some education from us.
Lisa Lifgren from CHI St. Joseph's Health Hospice Care. Our Medical Monday brought to you by CHI St. Joseph's Health, serving our community with exceptional top quality care. So we will visit again next month and have another topic, one of the directors of a department to visit with, but we appreciate everyone for coming in. Lisa, thanks for coming in.
Thank you for having us.